So back in 2007, we were in the process of designing a new hospital, and we wanted to move to what's called highly reliable care.
The whole notion of going to Baltimore was because Johns Hopkins was the first facility to have a command center.
And then as you begin to study command centers, you realize none of us would fly on an airplane that was not controlled through a command center. And so it struck us, why don't we have one?
We didn't necessarily know all the things that we could do with a command center. We had an idea, and we went off and essentially innovated on that. Our expectation was that as you become familiar with this command center, you're going to identify opportunity. A lot of people talk about, we can't afford it, like how did you guys have all of that money? Reality is that command centers have a payback which are easily under 3 years.
And so first what we needed to do for many of the aspects was study the current flow and the problems that we all knew existed and decide how a command center would work.
So we had everybody like EVS staff involved in designing EVS alerts. We had frontline nurses involved and all interdisciplinary staff that work within the hospital.
That was an incredibly interesting experience, and absolutely shows that when you put one of these in, you expose the understanding of what you can do with data.
Generation 1 was about process flow. It was about getting patients in, getting them through the hospital, figuring out what staffing we needed 2 or 3 days in advance.
So then we were into the second phase of our command center, where we really wanted to address a whole slew of quality-related issues.
And we used our patient care data to develop systems that would tell us if a patient looked like they could be septic, if they were deteriorating in any way.
Generation 3 was all about reducing unnecessary admissions.
And that's probably the most exciting part of the command center. The real great work that we've been able to do, and that's about high reliability healthcare.
Every single hospital should have a command center. Our patients deserve the best. Our patients should get care that's not just dependent on healthcare workers. There needs to be a component that also is artificial intelligence, like the command center, and those together provides the utmost care for the patient. And no hospital should not have a command center.